Hey, Margie here. Did you know that the fascia, or the connective tissue that runs throughout our bodies, can be the source of a significant amount of pain and dysfunction? Well, today we're delving into this topic with our very special guest, Sue Ellen Strong. And Sue Ellen is an expert in myofascial release, as well as craniosacral and neuromuscular therapies, yoga therapeutics, and bioenergetics. She studied myofascial release with John Branes and uses this powerful technique to treat chronic pain conditions, including sports injuries, neck and back pain, concussions, and migraines. She works with people with osteoporosis and uses myofascial just for enhancing optimal health. She is one of the creators of Myofascial Freedom, a practice in Morristown, New Jersey. Whereas many traditional approaches to treating pain act as band-aids and only treat symptoms, Sue Ellen is able to identify and treat the cause of pain and dysfunction in the body through an in-depth analysis of the body's myofascia. In today's interview, Sue Ellen explains the important fascial system that is so often overlooked and how we can all benefit from myofascial release. She even talks about an easy technique you can do to release the psoas, a muscle responsible for a lot of back pain and tightness. So stay tuned. Welcome, Sue Ellen. I am so happy to be here talking to you. I think we've tried to arrange this interview for, I don't know, a year and a half. And finally you're here, so yay.
Yay. Yeah, thank you for having me. I'm so excited to be here and to talk about all the wonderful healing properties of myofascial release.
Yeah, that's what's really exciting to me, because this is so important and it's not something people know about. I mean, as a physical therapist, I was introduced to this many, many years ago and have known about it for years and have seen the miraculous work. But the average person really doesn't realize that there's this amazing modality that can be so life-changing. So yay to have you on here. So you know what, before we get started, I think it's very important people understand your story and why you're so passionate about the work you do and how you got to be a myofascial therapist. So why don't you start with that?
Sure. It's an interesting story. It was interesting to me as well, going on this journey. I was trained as a chemist in undergraduate, and while I was working for a specialty chemical company in the personal care industry, I went to school at night and got my MBA. So really focused on the corporate world and doing work in business. But after my second child was born, she got very sick when she was 1 month of age, and she almost died. And we still don't know what happened with her, probably some type of viral infection. But as a result, she has severe cerebral palsy. And so, that changed my life in a dramatic way. And so I focused all my time and energy in really rehabilitating her as best I could. And I literally traveled the globe just searching for different therapies and treatments that would be helpful to her and just let her achieve her potential. So I did that, and when she was about 2 years old is when they first isolated human stem cells, and I realized that's really the answer for helping to repair her damaged brain. So along with some other parents of special needs children, we started a nonprofit foundation that funded medical research for kids like our children who had a variety of different brain injuries, brain damage, neurological disorders. And I did that for 6 years. So I really was on the cutting edge of, neuroscience research. I know all the top neuroscientists in the country, and they were really wonderful in supporting us, and we were happy to support their research. So I ended up leaving that organization, and I was really at a point in my life where I was wondering what I wanted to do. I was in my early 40s. I had just had to have a thyroidectomy, so my thyroid was removed. It wasn't cancerous, thankfully, but I had a lot of neck pain after the surgery because it's several hours and your neck is kind of in a distorted position during that surgery. So anyway, it was suggested to me that I seek out a therapist in Morristown, New Jersey, who did myofascial release. And so I went and received the therapy, which basically took care of my neck pain in one session, which was remarkable. And then I started bringing my daughter for therapy, and it was like a miracle for her. She started becoming more responsive. Instead of getting colds all the time, you know, she was just healthy. It just really helped her immune system. And it really helped her body, you know, stay in alignment and, you know, stay healthy, which was amazing for a kid, you know, in a wheelchair for her whole life. So she was about 9 when she started therapy. But also my body was just shot, like every joint hurt, you know, every muscle ached. And I just had incredible, you know, 9 years of just stress and trying to do it all, be her mom, her therapist, you know, her medical researcher, all of these things. So it was incredibly healing to me personally and for my daughter. And I would say, you know, very transformative in how my whole body felt. Like everything got easier. I was able to exercise more, and my body didn't ache. I just felt like I could handle my life and the stress of my life in a more, you know, stress-free, carefree way. So it really was remarkable, and I felt very drawn to do the work. So I ended up going to massage therapy school and then taking all of the John Branes classes. So he's our mentor. So we practice a form of myofascial release that was originated by John Branes, which is a little bit different than maybe some other forms. And just really have dove in and have been doing it now for 12 years, and am amazed every day by the power of the work and its ability to heal and relieve people of pain and just bring them, you know, to their potential and to live, you know, happier, you know, pain-free lives.
Well, it's interesting because I always talk about sometimes our biggest challenges, our biggest areas of growth, and you happen to be incredibly talented. People come from all over to see you, and you're my go-to person when something's hurting or someone in my family, because you have amazing hands and you're just very gifted. So it's unbelievable how you got to where you are, but that there was a silver lining in that, you being able to help so many people with your work. It's really quite remarkable. So people don't even know what myofascial release is. So let's start at the beginning, explaining what it is and what the fascia is and how this can really help us or be hindering us.
Sure. Well, very often we are unfortunately the last stop for people in pain with acute or chronic pain conditions. So they've had every kind of test, you know, labs, all kinds of therapy, and nothing has helped them. And it's generally then soft tissue issues. And so the fascia, which is myofascial release, means myo is muscle and fascia is the connective tissue. And so myofascial release is a very gentle form of hands-on therapy that looks for restrictions in the connective tissue, and using, you know, very subtle techniques, we're able to release those restrictions and restore alignment and function to the body. So fascia is a web. It's a 3-dimensional web. It was kind of funny a few years ago, I think 2 years ago, there were all these news articles. They discovered a new organ. It's called the interstitium. And we were laughing so hard because, like, well, we've been treating it for a really long time. So it's nice that, you know, it's finally getting some recognition, but it is a 3-dimensional web that goes underneath your skin. It's through the muscle and around literally every cell. So if you think about a chicken breast and you have that thin layer that you can pull off, that clear layer, you know, it doesn't just easily come off of that chicken breast. It really is sticky. There's all these different fibers that connect, and that's the fascia. It goes deep into the body in a 3-dimensional way. And that's why this work is so profound, because when you release the restrictions, it's a three-dimensional release into the body. And so, that's why we're so effective at relieving pain, but, a whole host of symptoms and disorders that we can talk about in a little bit.
So why is it not? Because a lot of people who might be listening might be thinking, oh, well, I do stretching. Can't that be opening my fascia? So
Right.
tell us why that really isn't the case.
Well, let me take a step back and say, how do you get these restrictions, right?
Yeah.
Where do they come from? So they can be from surgery. A scar is a very visible and a very palpable restriction. They can come from accidents, from trauma, from falls downstairs, falls off of horses, car accidents. I mean, the beautiful thing about our bodies is that they hold us together. We don't, splatter into a million pieces, but the fascia, the connective tissue that holds us together, when the energy passes through our body, little micro tears can be created. And when they heal, they create little restrictions all over your body. And, it may take 10, 20, 30 years for those to become problematic, but they do over time. So you can also have, stress from, overuse of the muscle. If athletes use, their muscles in a repetitive motion too often. You can have emotional scars that you hold in the body. And, that's something that has really been such a gift to me in this work, that when you really help someone let go of emotional stuff that they're holding on to, that's literally stored in their connective tissue, as it's releasing, often people, could start crying, or they'll say, oh, I just feel so emotional, or I have this memory of falling, into this pool or something. Why is that, why am I thinking of that now? And it's the memory that's stored in the body that they're releasing, that they no longer have to carry around in their body. And that can be, quite transformative.
It's so interesting you're saying that, because as a physical therapist, I've also done, it's not something I do 24/7 like you do. However, it's amazing when you see that. And a lot of people think they have to go to years and years of therapy for certain things. And when you release the tissue, a lot of times that problem is released, and they feel so amazing. It's just incredible. And I just can't get over that, this work has the ability to do that and really free people from some of the things that are really reducing their happiness and keeping them in pain.
Sure.
So
it really is an integral part of this work. So people who are listening to this may have had an experience like that. They may have had it while they were getting a massage, or they may have had it when they're doing yoga, especially like yin yoga, where you're holding a position for a long period of time. People can get these emotional releases, but they're really an integral part of how we approach our clients and just help them heal. And, that can be different for everyone. And some people, honestly won't ever get to the emotional stuff, but so many people do. And it's so nice to be able to give them that freedom in a way that, they wouldn't have been able to get in any other type of therapy. So.
And oftentimes they don't even know. It's just like a surprise. They have no idea they're holding something in their tissues.
Or that people and surgeons don't realize that every scar needs to be released, or at least looked at, because you don't know externally. You have a very beautiful looking scar, or maybe not so beautiful, but it's there. And when you start treating into the scar, people will say, oh, they may have an abdominal scar. They're like, I feel that in my back, or I feel that in my shoulder, or I feel that down my leg. That's how the scar tissue is pulling internally, even though you would have no idea just looking at it from the surface. So every single scar needs to be treated.
That's such a good point, because you could have problems anywhere in your body, and it may be coming from a laparoscopy you had in your belly button. It could be the smallest scar, but it could be pulling and causing dysfunction other places. So I think that's such an important point.
And
So
again, it may take 5 or 10 or 15 years to feel, the restriction caused by that scar, because every year the scar tissue gets a little shorter and a little thicker. So it definitely takes time to cause dysfunction, but you can be sure eventually it's going to be pulling on something.
And so why? Because a lot of people, as I said, listening, think, okay, well, I'll just do a stretch. Let's say I have some
Right,
restrictions in my chest. Let me
right,
just really do an active stretch or a stretch, and
right.
that will open it up. But it doesn't. Can you enlighten us to why?
Sure. So this is kind of all the rage, the new rage, all this myo stretching, like, places have opened up. I think they're mostly athletic trainers that are doing it. I don't think they're physical therapists or specially trained massage therapists. So it's a little bit worrisome that, people are going to try to stretch it out, because you can't stretch out a myofascial restriction. You need a therapist to assess where the restriction is, exactly what's not moving, and you apply a gentle pressure into the system, and you have to wait until it lets go. It's like stretching saltwater taffy or stretching steel. Like, the physics of it are very complicated. It's like a very long equation. But basically, it's a time element. That's what really makes the John Barnes method of myofascial release different, because I may wait, someone's psoas muscle, the hip flexor, that's such a huge muscle in the body. I may have to wait 20 minutes for it to start releasing, but I can feel when it does, and I wait for that to happen. So we need to be very patient, and we need to be able to feel when the tissue is changing. And generally, no one stretches for more than, 30 seconds to a minute in any direction. And it's just, that's really the problem, is that the time element is just not there.
And I see this so much with people for osteoporosis or who have posture, when people have been in a certain posture for a period of time and they're like, okay, well, let's improve my posture. Let's do stretching. And I think this is important for people because, yes, it's important to do the exercises that you see. However, if you're feeling that you just can't, like something is holding you back,
Right.
this could easily be the problem. And then if you see someone who's trained in this, then they release it and no problem.
Right. So a lot of times, if physical therapy isn't getting you the results that you're looking for, there's very often restrictions that need to be released first before you can strengthen the weak muscles. Because if you're not able to strengthen those muscles, there's a greater force, restricting your body. So very often for older people with osteoporosis, the thing that shrinks your spine and pulls your shoulders forward is your fascia. It's your connective tissue. And so very often, like, the pecs and the front of the chest get shorter. And so that really restricts your ability to hold your shoulders back. So the very first thing we'll do to try to get better, postural alignment is release the pecs and, all the muscles around the shoulder, so that you can then strengthen your rhomboids between your shoulder blades, and you'll be able to hold your shoulders back. It's a huge, it's a huge thing. And the other thing is that the fascia, the tightness of the fascia, is what compresses the spine. And that really affects bone health, because your bones are actually solidified fascia. And they're actually proving this now, because they have the technology to really look at how the bone reacts. And it really is solidified fascia. So it responds to mechanical stimuli. And so when it is compressed, it's not getting the blood and oxygen that it needs to stay healthy. And what people really don't realize is that very often when they have a fracture or a bone break, it's really the connective tissue, the fascia, that breaks the bone. It's not, that you tripped or, you fell down. It's like in our perfect, bodies where the fascia is free to move, you have enough elasticity to absorb the energy of that fall. But really, like, if I'm sure you have clients who have compression fractures, you know, that they don't even know where they came from. They came from the fascia, and they would really benefit from myofascial release, because you have to release the connective tissue so that the, you know, area between the bones and the area in the joint can expand.
So very interesting. And it's something that people just don't think about. So tell us
They
what
don't.
yeah, it's not something that, you know, but the truth is there are physical therapists who are trained in myofascial as well.
Mm-hmm,
John
mm-hmm.
Barnes, I actually took some of John Barnes' classes way back when he first came out,
Yeah.
actually. I knew John Barnes before he even started he was in a class of mine way back.
Oh, wow.
We're talking
Okay.
a long time ago.
Okay. Yeah.
But he's incredible, and his method is so. I mean, the two methods that I'm aware of that I think are really wonderful are John Barnes and then Upledger as well. Is that,
Yes.
yeah,
Yeah. And John has really incorporated Upledger's work in the cranial, you know, sacral
yeah.
part of what we do. But what I wanted to say about PT, I wish there were more PTs, especially in New Jersey, who did this work. But unfortunately, the PT model is that you're treating in 15-minute increments. So if you have to hold somebody's psoas for 20 minutes, that's a problem. So, you know, you're really just not going to be able to get the same results as a therapist who's going to, for a solid hour, you know, do myofascial release. I hope someday that changes, or that more insurance companies covered what we do. Many do at an out-of-network rate, but, you know, it really is something that requires a full hour of your time.
No, that's true. A lot of times, physical therapy is just what you said.
Mm.
And that's why I refer so many people to you, Sue Ellen, because I know how
Right.
talented you are and that you have the time to spend. You're right, because 10, 15 minutes is not going, is not going to do the trick. And, you know, sometimes
Right.
that's the situation, but there are other therapists. So I think it's just important, whoever you work with, know their training. What would you say, Sue Ellen, if people are looking, if they don't live in New Jersey, so they can come
Yeah.
to see you?
No, so
what would you recommend to people if
I
they're
would,
listening and saying, oh yes, you know, this sounds, I feel restricted, it's something I wanted. And the other thing is, won't they know, like even after one session, you'll feel some difference? Or what would you say?
yes.
Yeah.
Yeah, it's extremely rare for someone to not feel any difference after a session. And often people have been living with chronic conditions. You know, a recent client that was referred, she had pelvic floor pain for 8 years. That's a very long time. And in the first session, you know, after that, she was 50% better. I mean, that's remarkable. It's just I'm not even saying it's me. I'm like, it's the work, you know, it's just very solid. So there's a wonderful website that John Barnes has created called Myofascial Release. So it's MYOFASCIAL release.com. And on that website, there are all sorts of articles and information for people on a wide variety of dysfunction. And it's a great place to start. And there's a directory for all over the world, though most of us are in the US. And you can find a therapist who is trained in the John Barnes method on that website. So
Oh, that's fabulous.
hopefully there's someone in your neighborhood, but even if there isn't, I would call the closest person and ask if there's somebody even closer to you, because you do have to pay to be part of the directory. And so we were not on it for many years because we were already so busy. But then we felt like there was a time that we felt like we really needed to be on it. But we know who the therapists are in our area. So they may not be on the directory, but we know who they are. So we're very happy to refer to other therapists who are closer to our clients.
So I have a question for you, because so often you'll go to a spa and they'll have people who are trained in craniosacral.
Mm-hmm.
And so how do we know if they have the right credentials or not?
Well, pretty much if they're saying that they do cranial sacral work, they have taken some Upledger courses
Okay, good.
at a minimum. And again, you know, the work is very powerful. It's a very, there's a, you know, 10-step technique and or 12-step, I can't even remember, many step technique. And you know, someone who's been trained in that is going to have the foundation to do, you know, good cranial work. So if I can talk, can I talk about that just for a second, about the
Sure,
craniosacral work?
absolutely.
Yeah, so the craniosacral work is also very powerful. So Dr. Upledger, you know, probably 40 or 50 years ago, was able to prove that the fluid that surrounds your brain and spinal cord actually has a flow to it. It has a rhythm. So it goes down toward your tailbone and then up toward your brain about 6 times a minute is the flow of it. And there are many reasons why you can have dysfunction in that system, you know, injury, you know, stress, trauma, and myofascial or craniosacral therapist can hold someone's head and feel that rhythm and feel where it's restricted. And again, using gentle pressure into the system can balance that rhythm. And that, I would have to say personally, is if I only had 5 minutes for someone to treat me, that's what I would want, is for someone to balance my cranial rhythm, because it brings you such an incredible peace and calm to your body that you know, so many people who've had, you know, head injuries, concussions, they don't even know that they're walking around with a cranial system that has all this excess energy in it, except it may feel a little chaotic. We've seen many people, especially athletes, kids with multiple concussions, and I can tell by looking in their eyes and feeling their head how bad the concussion was. And the cranial work is really essential to recovering from a concussion, especially if there have been multiple concussions. Because when you have the first concussion, think about all that energy that's in, you know, pushed into your head, and that creates chaos in the system. I talk about it like shaking up a bottle of seltzer. You know, you're putting all that energy in. That's kind of how the fluid around their brain feels. We use, you know, just gentle pressure to balance that, and they feel incredibly better, and they're much less likely now to have another concussion because they can see more clearly. They just have a clarity that wasn't there before. So it's so important for, you know, people who've had concussions to get this work. It often will just take one session to rebalance the cranial system, and it just, you know, kids can go back to school, they can focus, you know, they stop having headaches. It's just really profound.
It really is. And I think even taking that one step farther, if you have a fall or something happens that's traumatic, right away get this done so you
Yes.
prevent problems in the future. You could just see someone one time just to balance things out, so you don't have to wait, oh my gosh, my TMJ hurts or my head hurts. Or you can really prevent things by just getting this looked at. And the other interesting thing I think with the craniosacral system is that nothing, you have to look at the whole body. I know that's what you do, is
Mm-hmm.
that if someone has a problem, let's say in their sacrum or their back, you
Mm-hmm.
need to look at the neck as well. It's not just one thing or another. And sometimes you will not get better. Let's say let's say a problem with your sacroiliac joint, right? You're just
Mm-hmm.
working on that. And there's a problem in the system, you need to deal with the whole entire craniosacral system. So I think,
Right. Right.
yeah.
Because it is all connected, you know, so the fascia runs from the top of your head to the bottom of your feet. And so if you're not looking at the whole system, and my favorite story about this is one that John Branes tells at his seminars, where he was treating a patient for, you know, quite a few weeks. And then he noticed this little, for headaches, and he noticed this little scar on her finger. And he's like, where did that come from? She's like, oh, I cut myself with a knife, whatever. He released that scar and her headaches went away. So her headaches were coming from a scar on her hand. Like, who would have, you know, that's why we treat every single scar, no matter how small it is, because you don't know where that fascial web is pulling. So they're very, just typical culprits, the psoas muscle or the hip flexor. Just show my little model in case people are listening. It's a very large muscle that's in your abdomen. It connects to the front of your spine from your lower thoracic through your lumbar spine. And then it anchors down in your groin at the top of your femur. So when people say they have a groin injury, it's very often their psoas attachment that they've strained. But this muscle is so huge. It's one of the largest muscles in the body, and it can, pull 2,000 pounds per square inch. So pretty much everything that's going wrong in the body is originating with the psoas. So you can't get your neck to release or your shoulders to release or your rib cage to release if your psoas is too tight. And it also holds a lot of emotion. So for most people, it's a problem, and it's really where we usually start, because I don't think I've ever found anyone who didn't need their psoas released. So it's important to understand that, and that is unfortunately some of the limitations with traditional physical therapy, and that you're given a prescription to have somebody work on your shoulder for frozen shoulder, but you're not going to really completely rehabilitate that shoulder till you release the psoas in the abdomen. So
you have some easy things that people listening can do a little bit themselves with the psoas. You want to
Yeah, I would encourage people to read more about it. There's some information on the John Branes website about it, but really, if you did nothing else from this podcast, you can use a ball. I have a little lacrosse ball here, but you can use something a little bit bigger. You can use a tennis ball. You can use an orange or a grapefruit. You can roll up a towel, whatever you want to do. But just push my chair back. What you want to do is between your navel and your hip bone is the belly of that muscle, is the biggest part of it. And you want to put the ball right there, and you want to lay face down on your bed or on the floor, and you want to just sink into it and just breathe. I tell people, put on 2 songs, about 5 to 10 minutes, and just breathe. And you also want to do your left side because you have one on the left too, but it's going to typically be tighter on the side that is your dominant side. And just lay there, and that will release your lower back, because it's the psoas that is compressing the lumbar spine and those discs in your lower back and creating most often, the back pain, hip pain, sciatic pain that people complain about really originate with the tightness of the psoas.
So that's such a great hip, and such a great hip, such a great tip, and it really makes a big difference releasing the psoas. That's huge.
It is, just because, if you just think of it logically, it's such a large muscle that if you have something creating that sort of force, you're not going to really get anything else to change in the body until you change that force. It just really makes logical sense.
A couple other interesting things that I've witnessed, and I'm sure you have as well, is that you could have internal organs that you can have dysfunction in actually organ systems that is released with myofascial. Actually very interesting. My daughter, when she was really young, was having issues, constipation and different things. And actually a therapist who is a mutual who we both knew, who unfortunately passed away, John Chappell, who was one of my favorites, he worked on her fascia and did myofascial release, and guess what? The constipation was gone. It was really quite, she was there for a different situation, and he had said, there's something restricting. Does she have this problem? I'm like, yes. Right. And after, it was really 1 or 2 treatments, that was the end of it. It was really miraculous. So what have you seen like that?
Yeah, so I've seen similar things, and John was so gifted, and your daughter's so lucky that he worked on her, because he just has magic hands. He is one of my mentors as well, and I'm forever grateful to him.
And wait, one thing, Sue Ellen, he was the one that gave me your name, because I asked him. I asked him for physical therapists. I said, who is really? He goes, the absolutely best person is Sue Ellen. So he spoke so highly of you, and that's how I actually first
Yeah.
got your name. So
Yeah, he was so special. So yeah, often, with my daughter, she's in a wheelchair, so she's chronically constipated, and I can always, get her to have a movement just with manipulation. And I often show parents with kids with that issue, how they can self-treat, and also, treat their kids so that it's not a problem. The other thing I want to mention, because we are talking about that, is magnesium. Because it's such a huge need for the fascial system. So unfortunately, our food, the soil that it's grown in is no longer really rich with mineral content. So even, if you buy organic foods, they just don't have the same amount of minerals that they did, 20 years ago. So almost everyone that I see is deficient in magnesium. And it's something that, unless you have a liver or kidney issue, you can always talk with your doctor about it, but pretty much everyone can benefit from taking some, every day. And it comes in liquid form, in powder form, capsule and tablet form, and gummies. It's like really easy to take. So why you need it is because your connective tissue, your fascia, needs calcium to contract. But if you don't have enough magnesium, your connective tissue stays too tight and it can't relax or release. So I can feel that when I'm working on someone. I can tell if people have not been taking their magnesium, they can't get away with it. And with me, I'm like, you haven't been taking it. And they're like, yeah, I ran out. I have to go get it. So, that's how different it makes the body feel. I can actually feel that it's more relaxed, and more flexible. So it's super important. And it also helps with constipation for parents out there. Go get the gummies and it'll change your life. So,
it's really interesting you're talking, because I'm a huge fan of magnesium as well. And recently on the podcast, actually, I had a woman who has transdermal magnesium and these soaps.
oh yeah.
So I've been doing this 30-day challenge myself, and it's incredible.
Yeah.
It is. And I take magnesium, so it's not that I'm deficient actually, but
Right.
just having this magnesium and doing these daily soaks has been amazing.
Right. So it
Yeah.
relaxes you and makes you happier.
It does. So let's talk about that. Let's talk about fascia and mood and happiness.
Sure. So, like we were talking about, emotional stuff that you can store and stress that you can store in your fascia. So a lot of times that's released in an energetic way. The person may not even be aware that their body is releasing all of this energy. But they often get up and they say, oh, I feel so much lighter. They just let stuff go and they feel lighter, and that creates more happiness in their life. And like I said, for me, it just, we all lead such stressful lives. It just makes living these lives easier, more manageable, less stressful. We just feel more calm moving through our day. And, that creates just an overall sense of well-being and happiness. So.
Oh, I love that. And the good thing is, this is doable. This isn't something that, it's thousands and thousands of dollars and it takes years and years. This is something that a couple sessions sometime can change your life. It's just that it's not, the biggest problem I see is that it's not known. And recently I went to a conference with integrative physicians. It was an integrative healthcare conference. And so there was a lecture on fascia, just like you said, like it's new. We've known how many years about fascia, that you must treat the fascia, but it's something that most people just don't realize, oh, I should get this looked at, or maybe I should see a myofascial therapist.
Yeah. So, some people are like, well, I don't really have any problems. Would I still benefit from it? And the answer is yes. It's really your answer for super health, because even though you may not have a symptom from a restriction or a misalignment, eventually you will, or at a minimum, you'll be losing height from gravity over time. And, myofascial release will just keep you healthier. It does boost your immune system because everything runs through the fascia, your blood, your lymph, your energy, your nervous system. So the more open that can be, and the more, blood and oxygen can be in every piece of your body, it really is the answer to, avoiding all of the things that, will get more blood to your brain. You'll be less likely to get cancer. I mean, one of the things that has been so rewarding for me is I'll often see women before their mammograms. So we'll treat their breast tissue, A, so that it's not as painful, because it is, and two, that if they have dense tissue, the doctor will be able to get a better view, and they won't have to have repeated images, which is more radiation, and they'll just get a cleaner image. But sometimes things pop up. And so sometimes there'll be something that they're looking for. They're going to go back and biopsy, and we treat the breast tissue. And I also show them how to treat it, because we're all about empowering our clients to treat themselves. That's really where, the real progress is made, when they're self-treating at home in between their sessions. But they're self-treating, we're treated, and they go back to try to biopsy it, and they can't find it. So that's been really rewarding.
Wow, that's incredible, Sue
Yeah,
Ellen.
that
Wow.
has happened enough times that I really feel confident talking about it. So yeah, and all of my female clients who see me, they don't see me every week, but they make sure now that they make an appointment before their mammogram, so that, we can treat their breast tissue.
Wow, that's so very interesting. This is great. So, are there any other things? I know the good news is that you're going to be making some videos of techniques that people can do at home, and I'm really excited about that. So those will be on your website when they're...
There will be links on our website to a new YouTube channel that we'll be creating soon. So it's not up yet, but you will be creating the video content, and we'll go into a lot more depth about effectively releasing your own psoas, and how to treat frozen shoulder and sciatic pain and TMJ and migraine headaches, and a whole host of other things. We'll kind of take it by, people always call and they ask, they want to talk to us, do you treat this or do you treat that? And the answer is yes. We treat everything. The only thing we can't do is if somebody is in need of hip replacement or knee replacement, if there's no longer cartilage or degradation of bone. We can't rebuild the bone, but we can bide you time, and we can create more space in the joint. And it actually is very helpful to have myofascial release before joint replacement and then after, because the forces that created that dysfunction and the wearing away in that joint are still there. So you want to make sure that you reduce those forces as much as possible, so that your replacement joint lasts you as long as possible.
That's a good point. And I think that same principle, Sue Ellen, with osteoporosis also, just like you said earlier, though, if there are forces pulling you, and you can release the forces so you're in better alignment and you're better balanced, just everything is going to work better, and your joints are going to have less force, and you'll probably feel 10 years younger. Am I right?
Yeah, I mean, I definitely feel younger today at 58 than I did when I first walked into the office at 43. I mean, my body was a disaster. I honestly felt like I was 90 years old. So now, I pretty much, do everything I want to do. I do yoga, I do high intensity training, lift heavy weights, because my daughter's 85 pounds and I need to lift her. And I pretty much can do everything that I want to do. And, that I credit really to having my body treated, for many years, not every week, but, just continually getting treated, because I was in a very bad car accident when I was 13. And so I had some issues maybe 5 years after that, where my whole back froze up and I couldn't move, which was very terrifying, at 20 years old to feel that. But now I understand it completely of why it happened. But I would have been having a lot more problems with my hips, with my knees, with my neck. You know, my head went through, like, hit a windshield and broke it from the back seat of a car. So, you know, I should totally have neck issues right now. So I just wanted to give a few examples, because a lot of times, like I said, people want to know, you know, what we can treat.
Sure.
But it's very often the most common thing we treat, I would say, is lower back issues, which are all being created pretty much from the psoas, and also from people just having a tight back plane of their body. So from their neck down to their feet is really tight. So we release both the front and the back, and it's, you know, completely effective. Sciatic pain is something that we treat very effectively all the time. You know, shoulder issues, frozen shoulder, you know, hip issues, issues with a tight respiratory diaphragm. People will often have, you know, asthma, they'll have GERD and, or, you know, acid reflux from a tight respiratory diaphragm. We treat a lot of chronic migraines, you know, different neck pain, a lot of concussions that I mentioned, and also, you know, pelvic floor issues for women. You know, we can't do internal work because we're massage therapists, but there's a lot you can do externally, and a lot you can explain to the client of how they can treat. That's extremely helpful for women for all different, you know, pelvic floor issues. So TMJ issues, you know, we work a lot on the jaw. You know, people hold a lot of tension in the jaw, they don't realize it. So, you know, that's just a small sampling. I also wanted to mention that we love treating babies because birth is traumatic, and we always offer a baby their first session for free. So if parents are having any issues with feeding, or, you know, torticollis, where the baby's preferring to turn to one side, any colic issues, sometimes the babies aren't eliminating normally, and we can help all of those things too.
And is that something that you had special training in, working with the babies? So if someone's listening to this and they don't live near you, I guess they have to ask, have you experienced?
Yes, I would ask the therapist. I mean,
Yeah.
My training really came from John Chappell, who was the baby whisperer.
Yeah,
So,
yeah.
yeah, so I was lucky to, you know, have some training from him in that area. I mean, the principles do still work, but some people are just afraid to work with babies. So you just want to ask your therapist if they're comfortable treating an infant. But you would treat a lot of women who are pregnant, who have lower back issues, make them more comfortable in preparation for birth. So we've even turned some babies, you know, just not with any manipulation, but just by giving the body space for the baby to turn. So lots of
Wow. So is there anything we missed here? I think you covered so
I
much.
think, yeah.
Yeah, I'm just really excited because whoever's listening and you feel like you're missing something, or you've been in chronic pain, or you feel tight and you feel pulled, or what you mentioned, I think so important. It could have happened when you're 1 year old and you're 60
Right.
now. That's what's so crazy. You continue these restrictions your entire life. So it doesn't have to be something that happened within the past couple of years. It could be something way, way, way back.
Or even something that you don't remember.
Yeah.
It doesn't really matter, because once your body releases it, you're going to feel so much better. I also want to mention, if people want to read more about myofascial release, there's a great book called A Patient's Guide to Myofascial Release, written by fellow therapist Kathy Koval, and it's, I think, like $10 on Amazon. So
Oh, great.
A Patient's Guide to Understanding Myofascial Release. And what else was I going to mention? Just the fact that, you know, getting myofascial release periodically and self-treating is really going to bring you super health. So it's a really important part for, you know, a lot of people who are listening. They want to be as healthy as they can be. And it's a real integral part of, you know, your total health plan.
That's so great. And it's just something that, as we said, A lot of people don't know about it, so I'm so glad that you came on. We've been talking about this for such a long time, and because I think it's an important topic and one that can be life-changing that maybe someone's not aware of, and it's something that, yeah, so I'm just very grateful for you, and I love going to you because you've helped me, you've helped my family, and you're just very talented, and you just bring a lot of light as well with your healing, and I just think you've helped so many people. So thank you so much for the work that you do and really enlightening all of us to the power of myofascial release. And I'm excited for your videos, and people can always email me or contact Youth, right, through your website.
Yes.
We'll give them the website so that they have your information. And thank you again, Sue Ellen, and I know we stay in touch, but it's really been a pleasure, and thank you so much for taking the time today.
Thank you for having me. And I just want to say, if someone has an acute or chronic pain condition that they haven't found any relief for, I would really encourage them to reach out and find a myofascial therapist from the directory on the John Branes website, myofascialrelease.com, to really, get your life back and, start healing.
Sounds great. Thank you so much.
Okay. Thanks, Margie. Take care.
You too. Bye-bye.
Bye.
I hope you've enjoyed my interview with Sue Ellen as much as I have, and now have an understanding of what myofascial release is, what the fascia is, and how this may be playing a role in any chronic pain or restriction that you're feeling. All the links we talked about will be in the show notes, and make sure to sign up for my 3-day happiness challenge. All the information for that will be in the show notes. So bye for now, and I look forward to seeing you on the next episode.